Hello, my name is Belén Eraso. My topic is comparing the predictive factors of salivary alpha-amylase and dental anxiety for intraoperative pain in patients undergoing dental extraction. First, definition. Human salivary alpha-amylase is the protein in saliva that is found in the highest concentration and possesses enzymatic activity. Since it catalyzes the -1,4 glucosidic bonds of starches and carbohydrates, it also plays an important role in the colonization and metabolism of bacteria leading to plaque formation. Dental anxiety is a term used to describe fear, anxiety or stress in a dental setting. Being scared to visit the dentist can result in delaying or avoiding dental treatment. Dental anxiety can be associated with certain triggers such as needles, or the dental setting in general.
Alpha-amylase is the glycoside hydrolase that catalyzes the hydrolysis of the alpha-1,4 glycosidic bonds, turning complex sugar molecules into simple sugar molecules such as maltotriose and maltose. Alpha-amylase also recruits bacteria in the mouth and on the tooth surface, which play a vital role in digestion as they aid in the hydrolysis of starches. Alpha-amylase is primarily produced in the salivary glands and in the pancreas. Because it is produced by the salivary glands, it is one of the first processes involved in digestion. Alpha-amylase is a 496 long amino acid enzyme that includes a chloride and calcium ion. It is a three-domain protein with a main catalytic domain consisting of a beta-alpha barrel structure that aids in binding of starches. Glutamic acid 261 and aspartic acid 231 form the cleft, or the catalytic diet of the active site that cleaves the connection between the sugars in the chain. Even though there's a difference of 15 residues between salivary and pancreatic amylase, they remain similar in function.
If you've ever felt nervous or anxious before a dental visit, you're not alone. But thanks to today's technology, dental visits are usually comfortable and virtually pain-free. If you have any anxiety, be sure to share your concerns with your dentist and the dental team. By discussing your worries, your dentist can adjust treatment to make your visit as comfortable as possible. If the sound of the drill causes stress, a good idea is to bring along an iPod with earphones and listen to your favorite music. Also, try to schedule dental appointments when it's most convenient for you and when you won't feel rushed. Your dentist cares about your comfort and does as much as possible to put you at ease. By working with your dental team, you can have an anxiety-free visit. Remember, a trip to your dentist should be stress-free. For the ADA Dental Minute, I'm Dr. Maria Lopez Howell.
Applications in odontology. Dental anxiety can be measured using subjective parameters, such as anxiety scales, and objective parameters such as body change in physiological biomarkers. Anxiety-related conditions are followed by autonomic change and measurement of salivary amylase can provide additional information on the changes that occur in some patients. As a biomarker of anxiety, the association between exposure to a stressful dental situation and the assessment of dental anxiety has practical applications for establishing strategies for help patients cope with the situations. Pros and cons. Pros. The salivary amylase enzyme function or hydraulic activity responsible for the degradation of starch in oligosaccharides, the digestion of glycogen, and other polysaccharides, bonding to the enamel surface or to the hydroxyapatite. It is used as a study tool due to its ability to reflect oral and systemic health conditions. Human salivary amylase, especially due to its high concentration, has been used as biomarker. Cons. Human salivary amylase concentration increases rapidly during acute stress. Since its release, like that of other salivary components, is regulated by the autonomic nervous system, in particular by the sympathetic nerves. Use applied in Ecuador. The main advantage of the determination of salivary amylase as a stress marker is the convenience of simultaneously evaluating the activity of the two main stress systems, the sympathetic nervous system and the hypothalamic pituitary adrenal gland axis. However, some characteristics of the enzyme involve difficulties for the collection and storage of saliva samples, as well as for the development of analytical techniques. It was possible to find a relationship between physiological reactions and invasive dental procedure. One of those that cause more anxiety in patients and contribute to a better understanding of the interrelation between the variation of salivary amylase concentrations and the subjective evaluation of dental anxiety. Finally, conclusion. Human salivary amylase is the protein with the highest abundance in total salivary content and participates in the initiation of digestion through its enzymatic action on the starches. It also participates in the maintenance of the humanity of the mucous membranes. Possible, its protective role of dental surface is more relevant when its concentration is high, but inhibiting its glycolytic activity may also be beneficial regarding the formation of adenobacterial plaque with less pathogenicity. The following video shows a patient's experience.
Answering these questions, please introduce myself. My name is Nick McCarthy. I'm English. I used to live in Bangkok, but I now live in the Philippines, where I had some dreadful dentist treatment. A very good Thai friend of mine recommended you. She's a patient of yours, and I came, and I'm extremely glad that I did. Why did you choose our clinic? Purely because my Thai friend recommended it. What was my treatment? I had a filling, but more importantly, I had a filling that came out in Cebu, in Philippines, a few months ago. Half of the filling came out, leaving the bottom half of the filling intact. And the dentist, the Filipino dentist, said it was okay. So I left it for a few months, and decay set in, and it went right down to the gum, to the bone. There was no alternative. We had 4 X-rays, and it was looked at by 3 of your wonderful staff, and they all recommended that unfortunately the tooth had to be extracted. Now I've got to tell you that I'm suffering from I've had dentist phobia, fear of dentists since a child, but I'm also suffering from anxiety. But in England we have such a thing as customer care. Bedside manner. We call it bedside manner. In England we've got very good doctors, very good surgeons, but sometimes their bedside manner is not very good. What I mean by that is they don't really care about you. They talk about you as if you're nothing. They don't help. They don't reassure you or anything, which is exactly the opposite of what I experienced here. So it says, how do I feel following my treatment? I feel extremely relieved that they did it, and I'm extremely grateful for the sensitivity all of the staff showed to me. I'll give you an example. Yesterday I was so anxious, I was too nervous to have the extraction. They said, come back tomorrow. They gave me a few tranquilizing drugs, and they did the the abstraction and the filling, and I felt so calm, which, considering my state of mind, is really quite remarkable. So the final question is, would you recommend this? And that is absolutely yes.
Thanks.